Hi, and welcome to the School Health Educators Podcast, where we discuss health education and how to best teach health ed in the K 12 setting. Hi, and welcome to the School Health Educators Podcast. I'm your host, Lori Reichel. Today's episode is focusing on the Health Education Council associated with Shape America, as well as Health Literacy Month. To help me out, I've been connected with some superstars out there in the United States, and they include Quigley, Adam Mullis, and Lennie Parham. So before I continue, I would like all of these people to introduce themselves and give a little bit about their background. Is there a volunteer that would like to go first and say hi and tell us about yourself?
Hey everybody, thank you so much for having us today. My name is Adam Mullis. I am a health and PE teacher in Georgia, formerly from South Carolina, and really excited to talk about the Health Education Council today.
Hi, my name is Quigley. I'm a high school health education teacher, and I also teach physical education as well. This is my 25th year of teaching, and today is my first day of classes. And I also was the 2023 National Health Education Teacher of the Year.
Hello, everyone. I'm Lennie Parham. I'm the Comprehensive Health and Physical Education Coordinator for the Department of Education in New Jersey. And I'm going on my 6th year in this capacity. And Melissa, you're rocking first day of school. And happy to hear that. And I'm happy to be here this afternoon. Looking forward to speaking with everyone.
So for the folks that are listening in, we are recording on Monday, August 25th. And as you know, some people have started the school year already. Some start later, some are earlier, depending upon where you are in the country/world. And before we jump into the questions that we are going to have answered in today's episode, can I just ask you all, why did you choose health or health and physical education? Why? You can pass on this too. That's that rule on this podcast. You're allowed to pass on any of my questions.
Now, let me just say, there's nothing more important than your health. So I think that really drives me in this profession. And especially having those connection with kids, parents, your family, there's just nothing more important than health. So that's why I'm in this profession.
Thank you, Lennie.
I would definitely agree. In today's age, I love being active. I love moving, and I love working with kids. And being a health and PE teacher is the perfect job for that. But at the end of the day, especially in health education, I feel like everything we teach is relevant to our students and about them. And not hating on any other subject, but there's some very specific content that you have to know in order to move. And there's some content that I haven't used that I've learned in other subjects, but everything that we teach about in health, whether it's content or skills, can apply directly to students' life and honestly my life as well. So I know it's applicable and it's relevant and it's meaningful.
And I think very similar to what Adam and Lennie said, I started out as physical education only, and I started teaching some health education classes. And I really loved to see the students embrace health. And I had one student walk away and say, "This is a class that's going to save my life." And that really hit home to me and really wanted me to become more passionate about health. And then I totally moved over to health education because of that.
So when I teach graduate level courses, a lot of my students already have physical education background, like they received their bachelor's degree and going for their license in it in the state. And some of them want to be more marketable and have health and physical education to get secure a job. Some of them fall in love with health education. And as a person who's very skill based, at first they're like, wait a minute, I'm not used to the skill based, because there are some practices out there that are more content based information. And when some of them learn the skill based and then even internalize it, they're healthier and they start falling in love with the field. I love hearing that. They're like, I really want to teach health. So I thank you all for what you're doing and for being here today. Thank you. So you're all members of the Health Education Council associated with Shape America. What is that?
So we're a group of health teachers, or we're involved in health in some ways, such as policy at a state level. We've had administrators on the Health Education Council, but we're really trying to advance health education at every level, from pre-K to high school to district leadership and admin. And we're trying to meet the needs of our members. We also review current initiatives to see if we should continue them or update them. And we'll talk about that a little later with some of our practice documents that we'll talk about. And this is all, of course, in line with SHAPE's strategic plan. We also make recommendations on new projects or new task force that may need that are needed due to current trends and things like that. And we, of course, stay connected with Shape America's special interest groups. We share updates with the board of directors, and of course, we're really trying to advocate and enhance health education so all students get a quality experience wherever they are.
So what you're doing on the council is volunteer work, if I'm understanding it. A lot of, I would say, what we do for organizations like in New York State, I do a lot of volunteer work for New York State AFERD. Some people are like, oh, you get paid. No, it's volunteer work. So why would you do that? Why would you do that? And why would you do it with Shape?
So I volunteered for the Health Education Council because I started volunteering at the state level with my state organization, and I felt like I needed to give back at a bigger level, and I wanted to advocate for quality health education that was skill-based. And so I looked into Shape America and saw that they had this National Health Education Council, and that's how I wanted to get involved in that at a national level.
Definitely the same. I'd like to add that being a part of communities like this, you get to be a part of what I call fellow unicorns. As a health teacher, you may be on your own little island, and maybe your district has awesome best practice, but maybe there's still some people who are stuck on content base, and at your professional developments, that's what you talk about. But when you volunteers for these things, not only can you advocate for something bigger for yourself, but you also get a benefit of learning what is most up to date, hearing about other educators and what they're doing, and really advocating on a national level. So not only can you help other people, but it also helps the other students in your life, because you can see more than just what's in your area. So there's so many good things about it. And yes, it is a volunteer situation, but I think it's well worth the connections, the people, and overall being the best health educator you can be.
Yeah, I echo what Melissa and Adam both spoke on. And just to add to that, from my perspective from the state level, I think joining an organization like the Health Council, really from my perspective, especially being in a division of instruction and planning and services to districts, and also in the standards office, it really helps build my own capacity individually, but not only just our office around standards and the driving forces behind performance expectations, right? But also just in terms of that global and national perspective, it really informs curriculum on the district level. So getting that national perspective around certain health topics, especially around different aspects of skill-based education along with standards-based, and then from the global perspective and how all the different approaches, that's really what I think really helps enhance not only my work, but also just all the work across the country when we start talking about standards education.
And I love that I keep on hearing skill based. And it seems like all three of you care about people being able to know how to do that, to how to teach to that, because it's not so easy if you weren't trained. And how do we teach the skill based in the skill based manner? And is that one of the things you're focusing on this year?
Yes. As we'll talk about some of the things that we've worked on, like the appropriate practices document that we've updated this year,
Okay.
we want to make sure that health education has kept up with where it needs to be. As you know very well, I mean, we can Google so much. I don't need to know every vitamin and mineral and what it does because that's simply in my pocket and I can look at it and Google it and ask AI and a lot of other things. But I do need to know how to figure out how to find that valid information in a trustworthy source. So some of the things we've been working on, as I just hinted to, an appropriate practice document, which is great for administrators or teachers or curriculum specialists who are trying to figure out what is best practice and what that looks like and what are the recommendations. We've also worked on inclusive practices in health document for guidance that recommends actions about skills-based standards and creating an inclusive learning environment. We've worked on a document about time in health education, what is the appropriate amount of time and how much is needed. We've put out several blogs around various topics around health education. We actually have coffee talks and presentations at our national conference. We put together calendars as well that have to do with health and wellness, and we've also done a webinar as well. So we do as much as we can handle as full-time, as our full-time job, but our main goal is to advocate, celebrate, and encourage great health education for all.
So the other item that I mentioned earlier in the introduction was that we're going to talk a little bit about Health Literacy Month. And would you remind our listeners what health literacy is, as well as what is this month is about, and that is coming up?
So Health Literacy Month is the month of October, so it begins October 1st. And currently on the Shape America website, there is a tip sheet that says how to celebrate your own Health Literacy Month. And it just emphasizes the importance of it and how you can plan ahead to have a big event in your school to kind of highlight health education and health literacy. So Health Literacy Month is just to kind of celebrate health education and put a spotlight on it. Some of the other things that we're going to be doing and putting out for Health Literacy Month are the appropriate practices and inclusive practices document that Adam just talked about. We're going to put out a supporting doc for that, and that's going to be released during that month. And it's also it's kind of like a tip sheet of like who can use this document and how can you use it. So as a teacher, how can you use those documents? As an administrator, how can you use those documents to encourage the use of them? And then each of us on the National Health Education Council, we created our favorite things, and that is going to go out on social media. And in those favorite things, it is like instructional strategies, resources on websites that we like. It could be lesson ideas. And I think some of us also linked activities. So you can kind of have some quick activities that you can do with your students that are all that are all about skill-based health education. And then Adam talked about the calendar. We do put out a Health Literacy Month calendar that has daily activities on there. So quick little things you can do with your classes as well.
Yeah, let me just add, also for those supervisors, and Melissa can relate to this too, it just gives them some quick grabs as well, maybe the things that can connect to their curriculum or some resources they know that their teachers may need. That's, they can see what's coming up in terms of the calendar. So I think our educators on our health council have done a great job giving those teachers those quick grab and go lessons.
Yeah.
And I definitely want to emphasize with Health Literacy Month that for I'm sure many of your listeners, a lot of our parents in our community didn't have a health teacher like you. So if we don't tell them about what health education is and how it's changed and why it's so important, then they may never know. So we really try to keep that in mind, and Health Literacy Month is just a great time to do that.
Yeah. Because if you're a parent that was taught in the former method, and I was even trained in the former method of here, have all this information, that's totally outdated because we know information doesn't necessarily mean it's something that's embraced into a habit. It doesn't mean I'm going to have those healthy habits, which is related to those skills. And it doesn't mean I'm going to continue those healthy habits or change my behavior. So that health literacy is so important to take the information, the functional health knowledge we need, good with the skill and apply it into our lives. It's so important. I find it fantastic that the Health Education Council is focusing on health literacy. And how long are you all on this committee for? Like, do you have a term that you're on for? Like, how does that work?
I believe it's 2 years. Correct me if I'm wrong, Melissa and Adam. It's 3 years. Okay, excuse me. Yep,
Okay.
so 3 years.
Okay. And so if somebody wants to get more involved, either in SHAPE or this HEC, what do they do?
Yeah, there's a typically an announcement or a broadcast that comes out from Shape America seeking candidates to be involved in all the different volunteer aspects. And uh, this health council is one of those areas where they can, if they're interested in health education, get involved with the Health Education Council, which is awesome. But I guess in order to do that, they need to be involved, stay connected, provide their contact information so SHAPE can send them all the announcements and broadcasts. So they're getting those every month, every week. And that's the first step, and then also just talking to other educators in the field. I think if they're connected with the health education profession, if they're involved with webinars, they're typically being, those things come up about how do you get involved. And I know SHAPE usually has a webinar every year about the different ways you can volunteer for SHAPE on a national level with them. And obviously the Health Council is one of those areas.
So if somebody's not a member right now, one way that they can find out some of this information is to actually follow SHAPE America on Facebook or another social media.
I think the website as well is a wealth of information, and you can find a lot of the information from the website. And that's where like the application for volunteers and all the deadlines and the different councils are as well.
And I'd also like to add, it may seem intimidating at first. And yes, we all have so much capacity and we want people to be healthy and well, and we can only do what we can do. But in my personal experience, I've had as a health teacher, as a PE teacher, I've had to really convince everyone around me why it is important, which kind of blows my mind when we talk about the content, the skills that are so applicable to our students' lives, adults' lives, and there's so many things like I wish, before I got married, that someone taught me how to communicate better. Really had to work on that. It is a tough skill, especially, when emotions come in. So my point in saying this is, you get a chance with these to advocate on a bigger level. So we understand and administrators understand and state leadership understand and even nationally why this is so important. So if you're even kind of thinking about it, go for it. Of course, it can be competitive. There are a lot of great people who can apply. So if you don't, I didn't get in the first time. Trust me, it happens, but I would highly encourage you. And maybe you want to start at the state level. We need great people there too. So it's a great way to get involved. And if you have the capacity, it's a great way to put your passion towards something that can really impact at the end of the day our children who need health and wellness now more than ever.
Thank you. And before we end for today, is there anything else you want to share with our listeners? Melissa?
I would say just get involved with your state and national level so that you can continue to advocate for skill-based health education. Because just like Lennie and Adam said, I think that there's not very many of us out there, and we are trying to spread the wealth and spread the knowledge and continue to educate not only our students and our state people, we are trying to educate other health educators as well. And just there's a wealth of information from Shape America. If you go to the website, there's lesson seeds and things like that that are very helpful to use as well.
Lennie?
Sure, let me just piggyback on what Melissa mentioned, because I think it's very important for all of our educators who are doing great work. And Adam kind of touched on this. If you're in the classroom, but all those administrators and building administrators and district administrators really appreciate your work. So I would really encourage you to broaden your perspective and get out of your classroom get on that state level, but in the national level, but just in your community, get involved with your health committee, that wellness committee. Those principals are looking for you to do those field days, whatever it is in terms of health, those health, uh, uh, it's not a field day in health, but it is in PE. So I'm looking forward to maybe seeing Adams, but maybe a wellness fair, anything like that. They appreciate that exposure that you bring, not only to your building, your district, but the families. And Adam talked about communication and some of those outreach. We talk about those partnerships all the time, and health education is a great way to build those internal partnerships, that school nurse, the counselors, and all those different areas in your building, but also in your community, you know. So I just want to encourage you as a health educator to keep doing great work, but don't be afraid to expand what you're doing so your great work can be shown and your kids can really benefit from it. And the adults in the building.
Oh, yeah. Thank you.
Absolutely. And I think I've said it 3 times, but advocate, advocate, advocate. And I think teachers are naturally so humble and don't necessarily want to be recognized. And as professionals, we may not need that, but health ed does. Health ed really does. We really have to advocate and help people understand we're just as important as every other thing students need to learn. And lastly, I want to encourage you if you have something that like, hey, why isn't the Health Education Council doing this? Um, Maybe we don't know. We are constantly working on reaching out to our members, seeing what is needed. But in our show notes today, we'll have a way to contact one of us, and we'd love to hear from you. We'd love to hear what we can do better. We'd love to hear if you have any questions. We really are here to serve in the capacity that we're able to. So, thank you so much for having us, and I hope that this was helpful.
It definitely is for me, as well as I'm going to put some notices out there on social media to remind people to listen in, because to be a member of an organization and to volunteer, there's so much that we can do when we work together, when we collaborate. And Standard 8, advocate for our field. There's so much possibility out there. And as you said, we're typically humble people that sometimes that humbleness makes us a little quiet, yet we need to learn how to use our voices. So I thank you, all three of you, for being here today. And as Adam mentioned, there is going to be information for how to connect with the folks that were on today's episode. I will have that in the description or below the description of today's episode. And I thank all three of you, Melissa, Adam, and Lennie. Thank you so much for your time today. And for our listeners, I thank you so much for listening in. And like usual, please make sure you follow the School Health Educators podcast. Please give a thumbs up. That'd be really, really wonderful. Also, check out the schoolhealtheducators.org website. And last but not least, I thank you so much for what you're doing. The children and youth need us out there, and I thank you so much for what you're doing. So take care of yourself, take care of your students, and have a great school year, folks. Happy Health Literacy Month.